Hello and welcome back to another episode of IgG4-RD Life. We are your co-hosts, Mahsa and Alex Stretchen, and we have another exciting one for you today. We'll be speaking with two of the most special people to both Alex and I's heart, Maria Picone and Christopher Defelice, founders of Trend Community.
Thank you, Mahsa. Trend Community is a community-powered digital analytics company. It turns conversations from social media into actionable insights with the goal of closing the gaps in the medical and scientific understanding of rare and chronic conditions like IgG4-related disease. And not only that, Maria and Chris are amazing mentors and friends, and also we wouldn't be here without them. And not only just with IgG4-RD Life, but also as ambassadors of IgG4-RD Connect, a one-of-its-kind platform and support group created by Trend Community, which we will talk about in today's episode as well. Maria and Chris started Trend Community as parents and caregivers of a child with a rare disease. And how did you guys start Trend Community, and how have you transformed your experiences into doing good for the world?
First of all, thank you, Mahsa and Alex. Feeling is certainly mutual. We are so honored and lucky to have met both of you and to be working with the IgG4-RD community. As you said, Alex, our journey started when we had our first child. Our daughter was born and diagnosed at 10 days with a rare disease called Prader-Willi syndrome. And our story will probably resonate with many of you. When we received our diagnosis, it was both terrifying and overwhelming. We went straight to the medical literature to try to understand what this diagnosis meant for our family and also for our daughter. And honestly, what we read only perpetuated those fears and concerns for her. And then I joined a community online of caregivers with PWS. And for the first time, Chris and I felt hope, because many of the kids were doing things that we had been told would never, ever be possible for our daughter. And we were immediately struck by what appeared to be a really big gap between what we'd read about Prader-Willi syndrome in the medical literature and what appeared to be possible for a kid born today with this rare condition. And then, Chris and I have been working in digital health and data analytics for many, many years at that point. And back then, it was actually really easy for us to hook into that group, pull out the conversation data, and start to analyze it. And what we really wanted to understand was, what were those parents doing that was resulting in such a positive health outcomes for their children? And as we started to connect the dots, we used that information to guide how we managed Prader-Willi syndrome for our daughter. And so capturing and analyzing conversations like this from social media is called social listening. And just to give you a little context, Prader-Willi syndrome is a genetic disorder that's characterized by obesity and something called hyperphagia, which is a chronic insatiable hunger. People experiencing hyperphagia never feel full, and very often families have to lock up their kitchens to protect their loved ones. So at the time, there were several promising treatments in clinical trials, and we were told this would never be a problem for our daughter. We were obviously very relieved of that. But we also realized that, that Prader-Willi syndrome is very complex. And so we wanted to understand all of the other things that were impacting the community. And the first kind of discovery that we made was to link Prader-Willi syndrome to another rare disease called narcolepsy. So back then, parents thought their kids were faking sleep. There were lots of clues like microsleeps while eating, head bobbing, and wasn't just our, analysis of the data. There were parents who were starting to kind of connect those dots themselves. And I'm sure you can appreciate that. A lot of what we do is really validating what community members, already know or are starting to kind of figure out. And so there was a mom who was an immunologist. Her name is Laura Pullen, and her son began having these daily, we called them sleep attacks at the time. And so we got together and started to try to really understand what was actually happening. And we consulted with pediatric neurologists at Texas Children's Hospital, Dr. Daniel Glaze and Amy Ravana. We sat down with all of that anecdotal data that we had and Laura and her family's experiences. And that's how we started to understand that our kids were not faking it. They were likely experiencing symptoms of narcolepsy and cataplexy. And we call this now a real world evidence accelerator. That's kind of the tip of the spear. We find these insights, then we partner with the community, with clinicians, key opinion leaders, industry partners, to try to make sense of that data. And then our ultimate goal, as you mentioned, Alex, is really to fill in those gaps in the medical and scientific understanding of these diseases. And so fast forward 4 years later, in 2016, we had been doing this for our own benefits. And then the FDA passed the 21st Century Cures Act. And this basically obligates the pharmaceutical industry to incorporate the patient voice into every aspect of drug development. And so at that point, we've been doing this, we knew that we had a really unique way to capture many perspectives of, entire communities. And so in 2017, we launched Trend Community.
Wow, that is so cool. That's such a wonderful story and a great journey just for that part. Chris, can you tell us from a technology perspective how you made those connections?
Yes, yeah, I'd be happy to. First, thank you for having us on. I appreciate it. It's been a pleasure working with the both of you. From a technology perspective, we use something called natural language processing. Most of the time, you won't hear people say that. They'll just use NLP for short. It's an approach that's been around for some time. It's been getting a lot more press lately with the addition of generative AI, or as more people are familiar with the term like ChatGPT, or maybe if you're familiar with Google Gemini, those use natural language processing, aka NLP, under the hood. These are approaches we've been able to use for many decades in more primitive forms, maybe symbolic. They usually refer to as symbolic or pattern matching or statistical approaches. Now through the ability for us to get our hands on compute, and obviously you hear a lot about these processing chips, smaller companies like Trend are able to actually explore and accelerate things in these areas as well. But natural language processing in itself allows us to do things with natural language. And what we're trying to do with natural language processing is program computers to perform tasks that help us be productive or to do certain tasks. It's been, so like I said, something that's been around for a while. And I think something that also might resonate with a lot is the assistive devices that we have on our phones, like our Siris or our Alexas. Those you also use NLP, natural language processing, under the hood. So it's something that's been around, and maybe you weren't aware of it, but you're hopefully, I think most of you are, and your listeners are familiar with those approaches. But that allows us then to look at this text, and like as Maria said, we do social media listening, and as we talk online and share our experiences, whether it's about our conditions ourselves that we might be diagnosed with or who we're caring for, we can parse that language to look for insights, such as maybe symptoms that we're discussing, the medications that we're discussing along with those symptoms, how we feel on a given day, how we feel, how our symptoms are making us feel at this moment, or maybe at another time during the week or in the past. And we can identify those and analyze that and aggregate that. So in a social media space, such as, our Trend Connect group, or say a Facebook group, or somewhere on Reddit, or another platform where we have many communities, not just IgG4-RD or Prader-Willi syndrome or narcolepsy. You have many of these communities kind of congregating in these areas, looking for support, providing support, and sharing these very rich, authentic, organic experiences, which find valuable. We found valuable in our journey as caregivers, and that's how we got, as Maria articulated, as we got into here. But we can parse that using natural language processing, right, to look in for those insights. So, some things like we can do is just, like I said, understand those clinical nature, right? So maybe some of the natural speak that we have for ourselves, we can map that more back to clinical terminologies or dictionaries, which allow industry people that can take that information, process that in a way that they're accustomed to then hopefully advance therapeutic progress better, more importantly too, though, understand and connect better with the patient population themselves.
Thank you for sharing that, Chris. Along my own journey, when I was going through that diagnostic phase, I turned to online and social platforms and support groups, because that's how I was learning about what I was going through was actually other patients were also going through. And we wouldn't have known this if we hadn't connected and we hadn't talked about it. I learned so much from what I learned through social discussions, online discussions, and then through social listening, like what you guys are really creating. And it helped me get my diagnosis, but also find my doctor who was going to get me the treatment that I needed, which was life-saving. It was a matter of life or, loss of life for me, without saying that word. So, there's so much power in technology. There's so much power in social discussions and social listening. And I'm very proud and happy that you guys have created such a platform, not just for us, but for all rare disease communities. IgG4-RD Connect is literally this platform where we can actually turn our conversations into insights. But I want to hear from Maria. Maria, can you tell us a little bit about IgG4-RD Connect, what it is, how it works, and how we're able to do research for good?
Absolutely. And thank you for sharing your story. I think, while these experiences are difficult, and we feel, isolated on these journeys, we certainly wouldn't wish that upon anyone else. So, part of the premise is that we want our experiences, as difficult as they may be, to empower someone else to get that diagnosis earlier. But also, just kind of rewinding for a moment, the work that we did in Prader-Willi syndrome was using Facebook data. And one of the limitations that we had was that we couldn't connect one user's conversations with another. So there were just limitations to what we could do with the Facebook data. Nonetheless, we were able to use those insights to really spark therapeutic progress. So to that point, and there had never been a clinical trial for treatment for any other symptom other than that hyperphagia, the hunger. Community was fully focused on that for obvious reasons. It was a it still is a very difficult and debilitating symptom. The problem with that, for those of you who aren't too familiar with clinical trials, it's really hard to study something different if you don't have data and you don't have tools to measure those new things. And at the time, we didn't have any of that data. It's called natural history data on narcolepsy in Prader-Willi syndrome. And we were able to use the social listening insights, we had a biotech company that just brought a drug to market for narcolepsy. And they actually approached us because we had been making a lot of noise, like you all do, about our experiences, what we're doing, what we're learning. And they wanted to consider doing a clinical trial for their treatment for excessive daytime sleepiness in Prader-Willi syndrome. So we were able to use those insights, sit down with the FDA, and show them that even though we didn't have a lot of natural history data, there was a really big unmet need. And so now we've been working with Harmony for the last, 5 or 6 years. They're in phase 3 clinical trials, and we're really hopeful that that drug will come to market in the near future for our kids. So that's the potential. So now that we understand what we can do with these anecdotal, the patient voice data, we've been thinking about, what if we could actually track a person's experience over time? And, the other piece is that in research, it's really important to get consent from the community. Like, you could do so much more when you can get consent, you can collect more information, you can then ask people to confirm their diagnosis, tell us their gender, we can have more details. And so from the very beginning, Chris and I have really prioritized privacy. We work with an institutional review board, which is an ethical oversight committee, to ensure that the research that we do is ethical. But we knew that if we could take this a step further and create a community where the participants consent to join and understand that there's a research component to the community as well. So like Chris said, it's really important to share, to get support. All of those things are important. But we then also have the opportunity to learn from the insights that we're sharing in real time with one another. And so that's what Trend Connect is. Trend Connect is, we do this with a lot of communities, but IgG4-RD Connect here, that's what that is. This is an online community that has a research component, and when participants join, they consent to participate in the research. And, I think one of the most important things is that we can't presume to know what we're going to find. And so using this approach, we can just listen, passively with technology to all of the different things that are happening and create this data that can hopefully bring more treatments to market for rare diseases like IgG4-RD.
Wow, thank you. Thank you for all that you're doing. This is really huge, Something that I've come across with our patients is that there's a lot of times, reasons for why they don't join certain communities or research studies or platforms is that they're worried about a breach of privacy, where their identities are exposed. And a lot of people these days with the tech today, a lot of us are very careful, right? Because we're very trying to be protective of our identity, the information we put out there that's more sensitive to us. So could you tell us a little bit about how we're doing the privacy for IgG4-RD Connect and how we're able to protect our patient member and community's identities?
Yeah, I'm happy to talk about that. Privacy is important. It's hard to have privacy online. So, it is the internet. So it's one of those things as a company, or whenever you talk about this stuff, you always have to lead with that caveat, right? When you are online, you can't protect it, from every malicious actor out there. But there's a lot of things that we do at Trend. And one of the things that's very standard in industry, and I hope that a lot of companies make a common practice, we certainly try to do our best by upholding it, is this privacy by design, right? So when we design systems or we're designing any type of research, it doesn't have to be software related either. It's just this privacy by design, this security by design. And I also throw in at the company a lot, ethical by design, keeping in mind. And one of the things at a high level, I always talk to our staff about here at Trend is, if you're not comfortable talking about our approaches openly and publicly, then question what we're doing, right? You should question then our approach, because if you don't think you can speak to it transparently and openly as if you're on stage at a conference, on a webinar, then we're probably doing something incorrect and we should rethink that process or that design. But some of the standard things that we do, although we haven't, the social listing hasn't been like under medical data or HIPAA data, we do, have our staff go through HIPAA awareness training every 2 years to receive certifications to, bring to their attention what PHI looks like, what PII looks like. So the combination of these things coming together, what constitutes that. Our system, just from a software standpoint, we go through all the proper protocols, right? So everything we do is encrypted in transit. We store everything encrypted at rest using the standard protocols that are the industry accepted. But the other big piece too that we do is all the analysis that we do is always done cloud-based, meaning that we do it within the confines of our VPC and behind firewalls through our cloud provider. We use reputable cloud providers, AWS, Amazon Web Services, which is one of the big three. You're either going to use Amazon Web Services, Google Cloud, or Microsoft Azure. So that's all done in there. And why do we do that? Well, we do that because I don't want people downloading data to their computers or their hard drives, right? So we alleviate as many risk vectors as possible. So if we're doing an analysis, and for the most part, many of our analyses, 99% of them are just used on aggregated data. But a lot of times we might be doing error analysis to make sure the models that we're using, or like people like to use algorithms, say, we test them for performance and degradation, right? Nothing lasts forever. It's just like your car, you got to keep servicing it, right? Your house, you got to keep going through that punch list. Even with these approaches, you got to make sure that, data drifts. People tend to talk differently over time. Data changes format. So you want to make sure that your models and your approaches on how you're using natural language processing or machine learning or your AI, so to speak, you have to keep testing that. So sometimes we have to analyze some of the samples and do our validations and go through our evaluation sets. But we always do that in a cloud-based environment that I know people, so I can see access coming in, right? I know who has access, the appropriate permissions are in place. But mainly, data is not leaving that environment. It's not going to a computer where that computer could be compromised, right? Now, we do have protocols for our company's laptops and stuff, but needless to say, I share that in terms of we always take this approach by design, whether it's, through the software, through our company protocols, and through company training. So that's how we treat the privacy and the insights themselves that are shared back, say, to either community members. But like I said, a lot of our industry stakeholders are biopharma and pharmaceuticals. They're aggregated insights, meaning that we're not sharing them a transcription of Mahsa's conversations in a Connect group or on Facebook if we were doing Facebook or any other social media forum. We don't share that transcript. We never share raw data back. They're aggregated insights, meaning that the community as a whole has been talking about these symptoms, right? They share these emotions related to that, right? If we were to do, like to Maria's point, through consent, we do some more longitudinal analyses. We can show a breakdown of, say, certain people's disease progression or how they're talking about that online, which is actually really powerful, but that's always anonymized, right? So even if I'm talking about, we're doing a longitudinal analysis of my conversations online, and I'm located in Philadelphia, Pennsylvania, we're not necessarily drilling down that deep. It'd be more high level stuff. We have a male, maybe in his young 40s, 40, just turned 46, but we'll say young 40s, a caregiver to a child, Prader-Willi syndrome, keep it high level. So those are the mechanisms that we take. Like, we're not looking to infringe upon anybody's privacy or group's privacy. I think we treat these spaces as a very sacred environment for everyone, because not only do we not want to fracture that environment for the people that are getting so much benefit out of it, we also participate in those environments. So we wouldn't want to sabotage the one thing that we have used in the past and currently use to also, not just, for our company, but we use personally for our lives and the betterment of our lives as well.
Also, if I could just add one more thing, with the IgG4-RD Connect, it's invite only, right? So that adds another layer. Whereas on, something like Facebook, I know admins generally do a really nice job of trying to vet the people that come in, but that can be, a big task. So by inviting people in and putting them through this consent process, they have to sign a consent form saying, that they are who they say they are. And so, we hope that that really sort of, limits access to people who are actually either living with IgG4-RD or suspect that they might have IgG4-RD.
Yeah, and also to add to that too, this is iterative, but the people that sign up and consent, we are putting things in place for them to be able to review the information they have, be able to download that information so it's portable for them, and mechanisms for them in case they, they would like to be removed from the system as well. They have those. So those are also coming down the pipeline as well, because we believe those things are also important. Because if you're adding information, maybe you want to take that information and upload that somewhere else into another system that you want to participate in. So there's those other pieces down the road to also help with that transparency and privacy aspect as well.
Wow, that's amazing. And it's great and comforting to know that privacy is protected, because it is a very huge part of the conversation these days. And we're so excited to be a part of this with you. Also, you mentioned some terms that may not be readily understandable to our audience, and I was hoping that you could elaborate on unidentifiable, PII, and PHI.
Oh, yeah. So PII, sorry, personal identifiable information, and PHI is personal health information. So that's typically the terms they use when you're dealing with medical applications, or if you're at your doctor's office, and if you're US based, you're signing those HIPAA consent forms and you're consenting to the transfer of PHI. PII is something which is also applicable to PHI, but PII, personal identifiable information, that is also where you might have stuff online where people are sharing identifiable information, which is very common in these places. So we try to put our staff through this awareness training on a frequency to make sure they're aware of these different, if it might come up, right? If it comes up through, let's say they're doing one of these analyses and some of that comes up, or say, unfortunately, say the model brings back too much information as we're putting together an analysis, we want to be able to identify that and remove that so it doesn't get shared. So that's why we go through that. My apologies for being a little vague or ambiguous with some of the terms that I'm using. You tend to talk about these with certain crowds so much you forget that you need to be a little more expanded.
Thank you.
Yeah,
Thank you.
and also just to expand, so PHI, personal health information, an example of that would be like your diagnosis. And in terms of unidentifiable information, that is to ensure that whenever we present the data, report on the data, that you can never link it back to an individual, that we don't ever want to, link data to a person. And like Chris said, I think most of the community now has seen the reports that we produce, and it's at a high level, like the symptoms that people are talking about, the treatments, and we are not interested at all in linking that directly back to an individual user.
Yeah, and like one of the other things that we do to mitigate those issues is, like I said, we use some of these models or algorithms, the AI, as artificial intelligence, everyone refers to it as. We have certain processes in place that are automated. So when the system does analyze, or say they call it like ingestion, or receives the data to do, because we have to receive the data to do the analysis, it will analyze it before it goes through any type of analysis or annotation to understand what's been talked about. It actually does something else where it will look for a certain PII and obfuscate it, basically alter it so it's, we don't know that it's Alex. So if Mahsa mentions Alex, say in our Connect space, at Alex, how are you? How was your trip? We can detect that name, or our system will detect that name, and then it'll supplant it with a placeholder. Something like there was a name, like name. So we know there was a name here that the author was referencing someone else, but we don't know who that was, just to preserve the anonymity, because sometimes people in their usernames will actually share their full name, and we don't want that bleeding through the system. So those are some of the other ways, and that's automated too. This way, like I said, if a data scientist who is someone that performs these data analyses they don't get that name, so they don't have to know who, know that there's a Alex or Mahsa or Christopher Defelice in Philadelphia who's caregiving for someone with Prader-Willi syndrome, right? So even internally, we try to protect it as well, even though like we're working very closely with the community.
Yeah, thank you. Thanks for clarifying that too. I often joke on our podcast and say that I've outed myself giving away my health information, but I'm doing it so other people don't have to, right? Chris, what can we expect in the near future when it comes to IgG4-RD Connect?
Yeah, so there's some exciting stuff that we released actually in the group last year. So I do believe that when we started doing this analysis, Marie and I, and we created Trend, we thought it was really important to make sure there was a give back component always with the community, since it is our conversations that we're analyzing and trying to promote and accelerate these initiatives that we are trying to do: treatments, awareness, helping newly diagnosed individuals cope and hopefully alleviate that weight on their chest. So, and that usually has been in the form of these like impact reports, the reports that we do the public initiatives that we try to do, where we share back the initiatives or the insights. But those could be timely, and a lot of times people want them sooner or more often. So one of the cool things that we did with Connect, and one of the big things too, in terms of this kind of symbiotic relationship that we have, where we want the spaces not to be necessarily trend, but the trend in the community, like the community, trend community, but the community, why we chose not to create our own system, but we host these on Discord. It's like a nice neutral area too. So this way it could be a space for the community, say if trend moves on, is not in existence, or or for whatever those reasons might be, but it's a neutral space where it can feel part of the community of IgG4-RD, Prader-Willi syndrome, or any other community that wants to partner with us in doing this, but also allows us to actually, which we can't do on other platforms, inject functionality into the spaces. So one of the things that I've been excited about to do, we released it the other week, is the AI system that we refer to as Christy. So we refer to our analytics engine as Christy, and Christy, it was named after a young girl who was diagnosed with Tay-Sachs disease. Unfortunately, was overcome by Tay-Sachs disease, but not before she put on this valiant effort and kind of defied some of those odds and lived for quite some time with Tay-Sachs. Her story actually inspired a lot of our staff at Trend, and our staff actually asked Marie and I if they can name the analytics engine after her. It actually wasn't even our suggestion, it was our staff. So it also shows, like, even though like Maria might be more of the external kind of presence and point of contact with a lot of people, it still kind of reverberates down into the company, where people really feel connected to the community and personal to the project. We have certain data scientists or analysts that work on a project, they feel very connected to it. But one of the things we want to do is be able to allow people to, since we're analyzing, we have all those insights that we have in our system at Trend, we want to be able to bring that to the community quicker. So we introduced, we refer to it as the Christy bot internally, or Christy if you're in one of the RD Connect spaces. And Christy allows you to ask her questions, just like you would any other, say, chat bot that you are accustomed to. She's still in alpha, so there's a lot of learning and development going on to enhance the capabilities of Christy. But Christy will allow you to ask her questions about, what are the symptoms that we're talking about? How often have we talked about a certain condition or a certain medication? When was the last time I mentioned this medication? I know we talk a lot about, one of the things actually I was quite impressed with, we talked a lot about here internally, is the symptom tracking, and how meticulous and detailed the symptom tracking is with some of the participants in the IgG4-RD Connect. So this could be one of those ways where maybe you didn't record your symptoms for a few days, but you can come back and ask Christy what you talked about. What were some of the symptoms I talked about in the last week? And Christy can tell you that, and then you can go and update your diary, or your, I guess the diary, or your symptom tracking notepad, or whatever device you might be tracking that in. So Christy allows you to do it in two ways. So you can talk, you can get at a community level, how much we're talking about something or how often or personally. But I couldn't ask Christy how often does Mahsa talk about this medication, or when was the last time Mahsa talked about it? Christy won't allow you to do that, but she'll allow you to talk about it personally, how much I've been talking about this, or how much have we as a community been talking about certain things. And this is just the tip of where we're at. But it's nice because you could speak to it in a natural language. So you can ask it in your language. Now, like I said, we're still in alpha, very early stages. So there's still some things that, she might not be capable of understanding, or she just can't answer. And hopefully she answers back, letting you know that. But and then she processes that, and then she can answer back in a more natural language way. So it feels like, it's more part of the community. But that's the most exciting thing that's coming down here. And that is kind of like our generative AI piece that we're offering to the communities that participate in the Connect or want to participate in the Connect spaces. So I've been super excited actually about this, although maybe I'm not showing that, but it's been something I've been wanting to do for quite some time. I haven't been able to, so these spaces are allowing us to do that. And so yeah, it's been super exciting developing it, and it's been super exciting playing around with it. I hope the community, finds it exciting and uses it, because also that feedback will help us develop it and enhance it. So we have a nice roadmap of additional features for it. But like I said, the more conversations we have in there, the more we'll be able to answer and she'll be able to share, provide those insights. So you don't have to wait for a quarterly report or an intake report from us. You could just get the information, just by going to the space and chatting with Christy.
Yeah, and to also touch up on your amazing work with Christy. Christy is a self-learning bot. If whoever's watching right now, if you watch our previous podcast episodes, we broke down our launch report and we did go over our Christy bot a little bit. It being a self-learning bot, I think is really huge, because we do see patients come in and have questions that they need to ask, like, hey, I'm going through this symptom. Is there any other patient going through it? And then it can actually tell you, yes, there's 2 other patients going through it. But as it learns, I think this is such a huge thing for us, because we would have like an IgG4 master, basically, that could answer these questions for us, even if, I'm no longer around, or if Alex isn't, if, some of us aren't around to help others down the line, then here's Christy. Christy can carry on the legacy, can keep learning, you can keep helping, healing, curing. So thank you. This is amazing.
Back when we were using Facebook to learn, this was actually our vision for the work that we're doing, because while those spaces are great place to connect and support one another, it's not a great space to consume that information. So, for example, if I wanted to understand, what was our community's experience with the ketogenic diet, I'd have to scroll through, go back, and as you all know, you tend to have the same conversations over and over, because every day you have somebody who's newly diagnosed and they're asking the same question. So our hope is, to your point, Mahsa, as Christy learns, that people can come in and they can learn from the experiences of those who came before them, and that we can start to elevate the conversation and, tackle other problems.
Sorry about that.
I wanted to, oh no, that's okay. I was going to add something else, just in terms of the future. IgG4-RD is also a very complex disease, and there's a lot that we don't know about it. And so for me, I'm really excited, for maybe a year from now, where we can publish on the IgG4-RD patient journey from the conversations that are happening on IgG4-RD Connect. That's what I'm most excited about, kind of for the future.
And it is really exciting. And you guys actually already did do our first poster presentation, which was at the Milan Symposium for IgG4. And That was really eye-opening for me, because we were, obviously you guys came in from the Connect side, and then we had other, interns and medical research students and doctors who came in with their poster presentations. And I learned so much from these different posters, because most of our market studies, research studies that are being put out, or most of our clinical trials, they're not all inclusive. So they're not really taking into account the more rare cases. And so I was able to see all these different organ involvements in these different poster presentations that literally our patients, I'm saying my patients, our patients talk about. And they're like, there is no information on this specific involvement that I have. And I saw their involvement. I saw the photos. I saw the research, and we came in and we provided a whole different side of it too. So this is huge. I learned what to add to my treatment plan. So I learned from, a presentation that came out of Australia, right? Patients were able to, help her go into remission, get off of steroids using Defelice. So this was something that I was like, I have to add this to my regimen. And I did. I took it to my doctors. We talked about it, and we were able to do it. These poster presentations, these publications, they're life-saving. So, it was huge for me. It was a game changer for me, just even seeing it. I think everyone can see my face looks different even from the day that I was in Milan, and this is because I was able to tweak my treatment plans. And this is why I really love the fact that we've, started IgG4-RD Connect, because this is what saved me and continues to save me daily and helps me take care of myself on a daily routine. And having these social discussions and then providing the insights that our doctors need is huge, because then they'll be able to look at that and treat us. So these publications are huge. We'll definitely be sharing the link to join us on IgG4-RD Connect in our description. You'll see that in our show notes below.
Mahsa, can I add one more thing? We're talking a lot about science. This group is obviously very passionate about science. But it is important also that we can live our best lives while we are, on this quest for treatments and cures. And so for us, it's equally as important, like Chris said, to give back, to find discover the unmet needs and try to find solutions that can improve quality of life. So one of the things that we've been doing with you all most recently is, mental health is a challenge for every rare and chronic disease community. And in response to that unmet need, we've helped to organize mental health support sessions with Dr. Al Friedman. So I just wanted to say that because, for some people, I think they can, while they can see the value, the science may not be their top priority. But I think, it's equally as important to make sure that we're thinking about all of the ways that we can improve quality of life.
Thank you, Maria. Yeah, that is very important because it's no walk in the park. And so we always like to end with a message to patients, caregivers, and medical professionals. So in closing, and I'm going to ask, we're going to go around the room here, and then I'll do that same thing, the same message. But it's going to be a different message, of course. But what is your message? We'll start with you, Maria, to patients, to caregivers, and to medical professionals.
So my message is that, we all bring something different to the table. We have different journeys. We have different perspectives. And that's why we love this concept of these real-world evidence accelerators, because we can all be inspired by one another and we can learn from one another. Patients have so much to teach our doctors, and we also have so much, obviously, to learn from them. And so my message is really, let's be super open-minded and see where the science takes us.
That's pretty cool. Chris, how about you?
Yeah, I think for patients and caregivers to know that your voice matters more than you know. Every experience you share, whether it's through surveys, social media, conversations, that helps shape the future of healthcare. So, keep speaking up and driving change. I think, and then lastly, for the caregivers, make sure you're taking care. Remember to take care of yourselves. We need to take care of ourselves. We're vital to the ones that we are caring for and their well-being. And then for the medical professionals, you know, you all are at the forefront of healthcare revolution driven by, you know, patient-centered care, patient voice. Keep listening deeply to the patients, to the caregivers, embrace their stories, and just keep in mind that, you know, you're not just treating a condition, you're empowering individuals and you're empowering families by considering that.
Thank you. Thank you. Mahsa?
Yes, my message is almost always going to be the same. Patients, trust yourself, trust your gut, trust your body. Doctors, listen to patients. Please listen to patients and be more open to learning. There's new data, there's new stats. Nothing is too rare. Even if it's too rare, there's at least 100 patients with that rare disease who are suffering and struggling. So patients, speak up, be loud. Doctors, listen, be willing to be creative. Caregivers, a lot of times we patients are able to tell you how to love us and be there for us. Please listen when we do and don't hate us for it. But also understand that we can't do it without you either in our lives. So we do really appreciate you. We love you. And Chris, Maria, thank you so much. You guys are not just changing the world, but you are saving lives. You started from your own home and your own family, and you expanded, and you're reaching out to so many of us. I know that rare communities were a minority, but we're actually a very significant number, and each life matters. So thank you for caring. Thank you for saving our lives. Thank you for doing this for your daughter. This is really appreciated. Thank you. We love you guys.
Well, I
Awesome.
definitely echo that sentiment. I took a couple notes for things that I wanted to share to our community of patients and caregivers and medical professionals. And one of those things is I have always been struck by this concept, and by always, I know that's hyperbole. Since I noticed on this Facebook group that I'm one of the admins of, the Living with IgG4-RD related disease Facebook group, I've noticed that a number of people, either they've been there for a while or they just get on there, and the first thing that they do is they start polling people about their experiences, or they'll get on there, they've been there for a while, and they'll start polling, literally polling the community about what drugs they're taking or what's it like to be doing rituximab and things like that. Or tell me about your journey. I want to, you know, because, oh, what's the cause? Okay, there is no known cause yet. There's a lot of suspicion, but there's no known cause yet because more research is needed, of course. So, you know, Chris was talking about like trying to parse out this information. I mean, yeah, sure, you can do it, but it's arduous and tedious. You know, Maria, to quote you, I hope you don't mind, you said this, you know, Facebook, it's not a great space to consume this kind of data. It's not. You need that stuff kind of digested for you and put out into mental pellets that you can consume, you know, the little protein bars or data. But that's just me and my imagination. But what IgG4-RD Connect is, it does that for you. So when you're trying to get a grip of what to expect of the disease, it's nice to be able to go somewhere where that grip, the handholds are bigger and the reaches between the handholds are smaller, because a lot of that heavy lifting is done for you by the research aspect of this community. The other thing is that your data is it's collected with consent, and and there's respect for your privacy, which in Facebook, well, we don't know. I mean, we assume consent because we're talking about it, but we also assume privacy. And us admins, we're very, very we try to be as strong as possible as watchdogs to protect the vulnerable community from people who are just going to like go pillaging through our experiences. So this is a way to do that more safely. And what is this note? Something about, oh, right. And lastly, I don't even know my own writing. The last thing I want to say is I will often, so this is a message to everybody, but I often talk to patients about being a part of your own wellness team, right? So you can take this data, take it to your doctor as part of your own wellness team. But what this also is that you are part of your own research team as well, the global research team. So that's my message to patients, caregivers, and medical professionals. And so, yeah, I want to thank Marie and Chris for taking the time to speak with us today, not just to talk about their amazing accomplishments, but also how they have been and are continuing to help rare disease communities like ours. So I want to thank you, Maria, and thank you, Chris, and then hand it back to Mahsa.
Yes, thank you guys so much. We can't thank you enough. We'll always thank you guys. You know this. We love you. Everybody follow, like, subscribe to all of our socials online. We will be sharing Trend Community, Trend Connect, so that other rare disease communities, you can also reach out. They'll have a page and you can join the group that you need to join. You know, you may have a different rare disease. We will provide all that info for you. We will provide you with IgG4-RD Connect as always, and we look forward to seeing you next time. Thank you. Love you all, and have a wonderful day.
Thanks. Love you.